Last year, we had the great privilege of serving over 121,000 unique individuals, bringing hope, breaking despair, and focused on building Africa.
It's been Living Hope's mission on the continent for 25 years. In celebration of the milestone, Executive Director Victor Thomas credits much of the organization's success to PEPFAR.
Where both helped us in the prevention side of things as well as treatment, and we were able to do incredible work amongst youth and teens on the prevention side, as well as treatment and testing in clinics.
Since receiving the first round of funding back in 2004, Thomas says the program has been highly successful from the start.
From year one in our healthcare facility, we saw 95% of people die from the disease. But come year two with ARVs and PEPFAR's partnership, we saw 95% of people thrive and live healthy lives.
Thomas says the fight continues in underserved areas along the Eastern Cape province. He notes HIV/AIDS cases there are increasing, especially among teenagers. Republican Senator Susan Collins continues to fight for keeping PEPFAR aid flowing to Living Hope and other foreign agencies. Last year, she opposed cuts of $400 million.
The funding for PEPFAR is slightly lower than last year, but much higher than what the president's budget proposed.
Collins chairs the Senate Appropriations Committee, which is currently considering a spending bill that would invest in life-saving global health programs, including PEPFAR, Gavi, and maternal and child health agencies.
There are some exciting developments. For example, there is a vaccine that is being developed that would replace the need for daily medication, and that could help make it more practical for a country in Africa, for example, that lacks resources to take over the program.
As vaccine breakthroughs continue, so does the plan for the U.S. to dwindle down and eventually phase out direct funding to many countries.
There's supposed to be a significant reduction by 2028. Do you think that's enough time?
We're not there yet. So I think what this has to be on a case-by-case basis, dependent on the resources, the infrastructure, and new methods of treatment.
The America First Global Health Strategy, released in September, aims to transition these countries to total self-reliance by 2030. Collins says while it is an aspirational goal, it's going to take outreach, education, and U.S. healthcare providers being there on the ground, assisting local staffers.
To me, this is carrying out what Jesus would want done. It is taking care of the least of us.
Michelle London, CBN News.